the destruction of your red blood cells, the destruction of your red blood cells. Okay? Your erythrocytes, the destruction of the red blood cells or your erythrocytes. Next, CSF protein, pag-increase ang CSF protein, ito yung sinasabi natin kanina. Okay, pag-increase ang ating protein, then that suggests possible, number one, diabetes mellitus. Number two, tumor. Number three, trauma. Okay? I repeat, when your CSF protein is increased, it may suggest diabetes mellitus, it may suggest trauma, it may suggest tumor. Okay? Pag-decrease ang protein mo, then that suggests now, increased CSF production. Increased CSF production. Ibig sabihin, masyadong madami yung lumalabas na CSF, okay, than the normal, than what your subarachnoid or choroid plexus must produce. Halimbawa, ang tanong ay where is CSF produced? Sabi ko kanina, subarachnoid space. Pero pag walang subarachnoid space doon sa option, you look for choroid plexus. You look for choroid plexus. Because this is exactly where your CSF is produced. It is located in your subarachnoid space, but particularly the very specific site of CSF production is your choroid plexus. It is the one that protects your CNS, your brain, your spinal cord, your choroid plexus. It regulates the environment, okay, in the brain and in the spinal cord. Let's go. Gamma globulin. Your gamma globulin, sabi natin kanina, ang gamma globulin ay ilang percent lang, 3 to 12%. Pag increase ang gamma globulin mo, then it may suggest the generation of the myelin sheath. Okay, the generation of the myelin sheath. Degeneration. Okay? Ibig sabihin, medyo pa-old na yung myelin sheath natin, pa-destroy na yung ating myelin sheath. What exactly is your myelin sheath? Your myelin sheath is the one that covers your nerve fibers. Diba? Your myelin sheath is the one that covers, that surround your nerve fibers, the nerve fibers of the brain and the spinal cord. It surrounds, it covers a healthy nerve fiber. But there are conditions, okay? There are conditions that may destroy a healthy nerve fiber. There are conditions that may destroy your myelin sheath. Okay? Particularly your multiple sclerosis. Your multiple sclerosis okay? Your multiple sclerosis and your Guillain-Barré syndrome. Your Guillain-Barré syndrome. These are two examples or situations wherein your myelin sheath is destroyed. Your myelin sheath is the one that covers, that surrounds your nerve fibers, your healthy nerve fibers. Okay? So in your multiple sclerosis, ang presenting sign nito, the earliest is a vision loss. Okay? The patient may complain of a vision loss. Okay? The patient may also complain of double vision or diplopia. Okay, the patient may also complain of double vision or diplopia. Okay. Later, meron tayong illustration. Makikita pa natin yung ibang signs and symptoms mamaya. Okay, so aside from diplopia, the patient may also complain of dysarthria. dysarthria. It may when you say dysarthria, there is impaired swallowing, and even slurred speech, impaired swallowing and impaired speech. Okay, impaired swallowing and speech. Okay, for your Guillain-Barré syndrome, ang dapat mo lang tandaan sa kanya ay one of the signs and symptoms is your paralysis. Okay, so merong ascending paralysis and descending paralysis yung pasyente. Ibig sabihin, paakyat yung kanyang paralysis at pwede rin itong pababang paralysis mula sa kanyang mata down to the toes. Pag sinabi mong descending paralysis. Okay? So your Guillain-Barré syndrome is actually more of an infection. It is more of an infection and inflammation of the myelin sheath. Okay, it is more of an infection or inflammation in your myelin sheath. Okay, you have to remember that both are autoimmune also. There are both autoimmune disorders. When you say autoimmune, the immune system of the patient is the one that destroys the myelin sheath. Okay, it is the one that destroys the nerve fibers. I repeat, sabi nila, both are autoimmune disorders, meaning when you say autoimmune, your own immune system, kinakalaban niya, it destroys, it considers your nerve fibers as an enemy or a foreign body. Okay? Kaya mahirap na meron kang multiple sclerosis or Guillain-Barré syndrome. Okay? And by way of lumbar tap, pwede nating malaman kung merong ganitong sakit ang mga pasyente. Bakit? Titingnan nila yung CSF ng pasyente, bakit mataas ang gamma globulin? Yan. Bakit nasa 24 ang gamma globulin niya? Ibig sabihin, okay, destroyed na ang kanyang myelin sheath or yung kanyang nerve fiber. Let's go. CSF glucose. If your CSF glucose, ang normal nito is 50 to 80. The normal is 50 to 80. If I'm not mistaken, I think I mentioned this a while back. Increase ang glucose mo with hyperglycemia. In case of diabetes mellitus, malamang. Okay? And decrease ang glucose mo. Number one, with hypoglycemia. Okay? With hypoglycemia. Number two, to a patient with tuberculosis, to a patient with meningitis, to a patient with tuberculosis, to a patient with meningitis. Okay, let's go. CSF cell count, your red blood cells, di ba dapat wala? Ang red blood cells mo, dapat wala. Di ba? Ang red blood cells mo, dapat wala. When they are present, then that indicates now a subarachnoid hemorrhage. It may indicate now a subarachnoid hemorrhage. For your increased WBC in the CSF, it may suggest CNS infection. Okay, it may suggest CNS infection. It may suggest a trauma. Okay, it may suggest a possible abscess. Let's go. For your CSF chloride, nasabi ko na yata ang normal value. The normal is 113 to 130. Okay, pag decrease ang chloride mo, then that suggests meningitis, guys. It suggests meningitis. Okay, for your gram staining, kapag gram positive or gram negative yan, then that suggests now possible bacterial meningitis. It may suggest bacterial meningitis. It may suggest bacterial meningitis. Okay? I'll just check on you. Baka mamaya salita ako ng salita, wala na pala kayo. Okay, so that is for your normal and abnormal CSF laboratory findings. Okay, these are the nursing responsibilities when obtaining specimen collection. In our particular case, our specimen would be your cerebrospinal fluid. So what are the nursing responsibilities if the doctor would order for lumbar tap? Number one, note relevant information on the laboratory request slip. Okay? So ang nurse dadalhin sa laboratory yung sample ng CSF na nakuha natin. Okay? Sa bedside or sa room ng pasyente. Okay? So ano bang meron dito sa laboratory request slip na to? Okay? It contains the diagnostic procedure done. Okay, it may contain the specimen, the name of specimen. It should be your CSF specimen. It contains the date, the time, the doctor who ordered it. It may also of course contain the details of your patient. Okay, explain the purpose of a specimen collection and the procedure for obtaining the specimen. Okay, to allay anxiety on the part of the patient. Okay, so that the patient would be knowledgeable. Okay, why are we doing this for him? Okay, and as well as the correct procedure or the steps involved in obtaining a CSF sample. Okay, all for decreasing the anxiety, okay, of your patient. Okay, the patient has the right to know. Okay, why are we getting a sample of his cerebrospinal fluid? Okay, number three, provide client comfort, privacy, and safety. Okay, so during the procedure, you have to assist your patient to a semi-faller's position or not a sitting or upright position. Okay? You may also assist your patient to a side-lying position. Dalawa kasi yan. Pwedeng fetal position. When you perform a lumbar tap, it could be a side-lying position or fetal position. It could also be a sitting upright position. So the role of the nurse is to assist the patient during when the when the physician now inserts the needle, okay, into the back, into the vertebra of your patient. Provide client comfort. You ask the patient first to empty the bladder before the procedure. Ayaw natin na si pasyente ay naiihi, gagalaw-galaw yan, baka mamaya ibang matusok ni doktor. Okay, kung saan-saan na pumapasok yung ating spinal needle. Okay? Ayaw natin ng bloody trap. Okay, meaning yung makuha nating CSF sample ay punong-puno ng dugo. Bakit galaw ng galaw si pasyente? We do not want that. Okay? Privacy, you have to close the door, you have to close the windows. Okay? You have to put on the curtains, close the curtains, ganyan. Okay, to provide privacy to the patient. Use correct procedure for obtaining specimen collection. Actually, it is the physician who performs your lumbar tap. Nurses do not perform this particular procedure. What we do only is to assist the patient and to assist the physician. Mag-abot tayo ng instrument kay doctor and then we assist the patient in positioning. Okay, transport the specimen to the laboratory promptly. Okay, 30 minutes of delay. 30 minutes of delay would affect the result of your CSF sample. So once you obtain the CSF sample, okay, in 3 test tubes, tatlong test tubes ang kailangan natin. Itong tatlong test tubes na yon, half filled with CSF fluid, dadalhin yan sa laboratory, okay, immediately to get accurate results. And then, once you get the result, itatawag yan ng laboratory sa ward na, ma'am, pwede na pong kunin yung result, available na. Okay, whatever abnormal findings, we have to report immediately to the concerned physician. Okay, so nandito na tayo sa actual procedure for your lumbar puncture. Or main topic natin, your main topic for this morning is your lumbar puncture. So you have to remember that your lumbar puncture is an invasive procedure. Therefore, it is necessary that we obtain consent. Okay? Have your patient sign a consent form because it is an invasive procedure. This procedure involves insertion of a needle into the lumbar subarachnoid space particularly between your L3 and L4. Andito yung picture natin. This is your L3 and L4. Nandito po ang illustration natin. And then L4 and L5. So yung dalawang yan, ang the best sites of your is insertion of your spinal needle. Okay? So dyan nag-i-insert si doktor ng spinal needle sa L3, between L3 and L4. You have to remember that. L3, L4, between your L4 and L5 also. These are the ideal sites of insertion of your spinal catheter in a lumbar top. What are the other names of a lumbar top? What are the other names for a lumbar puncture? Okay, aside from it is a lumbar puncture, it is also known as a lumbar top. It is also known as a lumbar top. It is also known as a spinal top. It is also known as a spinal puncture. It is also known as a thecal puncture. Thecal puncture. It is also known as a rachiosynthesis. So these are the other names for a lumbar top. Your lumbar top, a lumbar puncture, lumbar top, spinal puncture, thecal puncture, rachiosynthesis, pare-pareho lang yan. Okay. You have to remember that for the entire lumbar top puncture or top, it may take about 30 to 45 minutes. So if they ask you in your first term exam, for how long should the physician perform a lumbar puncture, it should be about 30 to 45 minutes. 30 to 45 minutes. Okay, so a successful lumbar puncture requires that the patient may be relaxed. You have to remember, guys, dapat relax ang patient mo. Okay, kasi mag-i-increase yung reading natin. Mag-i-increase, mag-iiba yung result natin. Okay, kung anxious si pasyente. Okay? Kailan ba kasi magiging anxious si pasyente? Number one, kapag hindi mo yan pinaihi. Maya, sabi niya, naiihi na ako kaya ako galaw ng galaw. Ganyan. Or baka the patient is not fully aware as to why, okay, as to why we are getting a sample of his cerebrospinal fluid. So it is very important that the nurse explains the reason why we're getting a CSF sample, explains the procedure involved, the steps involved in a lumbar top. Okay, so if a patient, a tense patient, okay, an anxious patient would result to an inaccurate reading, even increase CSF pressure, increase CSF pressure. So one of the responsibilities of the nurse is to be able to provide thorough information and instruction before, during, and after the procedure. Advantages of a well-informed patient. Of course, hindi na yan magtatanong. Makikita mo na he is just relaxed because he is aware of what may happen in the entire procedure. Okay, so it will decrease the fear and anxiety. It will also lessen the occurrence of potential complications of post-lumbar puncture. Kasi when you discuss already what he should do after, okay, then mas maganda. Kasi ano ba yung mga complications ng lumbar puncture? Headache. Okay? Kasi hindi mo in-explain sa kanya na kailangan naka-prone muna siya for about 2 to 4 hours. And then later on, saka siya mag-flat on bed. So pag clear lahat ang instruction mo, then we will not have post-lumbar top complications and other problems. Okay, bakit natin ginagawa ang lumbar puncture? Sabi ko, number one, it is the best diagnostic procedure for your meningitis. It is the best procedure to rule out or to diagnose your meningitis. Okay, other specific indications to obtain CSF for examination para malaman natin kung may white blood cell ba yan, may red blood cell, may chloride, may gamma globulin, may glucose, may protein. Okay? To measure and reduce CSF pressure, alam mo na ang normal pressure, it is about 70 to 180 millimeters of mercury, or that is about 0 to 20, 0 to 10 millimeters of water. 0 to 10 millimeters of water. Okay? To determine the presence or absence of blood in the CSF, okay, because the presence of blood in the CSF may indicate a possible subarachnoid hemorrhage. It may indicate a possible subarachnoid hemorrhage. Other specific indications for lumbar puncture: to detect spinal subarachnoid block. Okay, meaning to determine if there is a subarachnoid obstruction. Kailan ba nangyayari ang subarachnoid obstruction? When there is a brain tumor, when there is a cerebral or a brain lesion. A brain lesion or a tumor. Okay? To assist in the diagnosis of suspected CNS infection, particularly your meningitis. It may also assist you in diagnosing intracranial or subarachnoid hemorrhage. Oo, kasi pwede nating makita na nag-increase ang RBC sa CSF, nag-increase ang protein, ganyan. And also, in the diagnosis of some malignant disorders like your brain tumor, your brain cancer, your malignant brain tumor or malignant brain cancer. and another reason kung bakit natin ginagawa ang lumbar tap is to evaluate and diagnose demyelinating or inflammatory CNS processes, particularly yung diniscuss natin kanina na demyelinating disease, your multiple sclerosis and your Guillain-Barré syndrome. Your multiple sclerosis and your Guillain-Barré syndrome. And of course, okay, by way of lumbar tap, pwede rin tayong mag-administer ng mga medications natin. Example is spinal anesthesia before a procedure like your CS or your cesarean section delivery. Another reason as to why we perform lumbar puncture is to treat normal pressure hydrocephalus. So when you say hydrocephalus, sobra-sobra yung CSF niya, may fluid sa kanyang brain, masyadong malaki yung kanyang ulo. Ayan po, may tsura ng bata diyan na merong hydrocephalus. So pwede tayong mag-lumbar puncture para mabawasan ang excess fluid dyan sa ating brain. Okay? To treat cerebrospinal fistula, pag sinabi mong fistula, may opening, okay? May opening dun sa ating subarachnoid, nakakalabas yung CSF. Okay, by way of lumbar tap, pwede nating ma-resolve ang problema. Next, idiopathic intracranial hypertension. You just have to remember that your idiopathic intracranial hypertension is characterized by a very high pressure in the brain. Very high pressure in the brain. And the signs and symptoms of your idiopathic intracranial hypertension is the same as the signs and symptoms of a patient with brain tumor, Okay? So malalaman mo na meron niyang idiopathic intracranial hypertension if a watery discharge comes out from the nose of a patient and comes out from the ears. Okay. Paano mo malalaman na ang discharge pala sa ilong ay hindi yan sipon, kundi cerebrospinal fluid yan? You have to get a pH paper, guys, or your nitrazine paper. Okay? Originally kasi blue ang nitrazine paper, your pH paper. Pag nag-pink yan, then that indicates now na acidic. Okay? Pag hindi nag-change yung color, then that means na alkaline siya. Okay? Alkaline siya. And sabi ko kanina, ang pH ng ating cerebrospinal fluid is alkaline or basic. Okay? So, halimbawa, pag nahihirapan ka sa lesson mo, nahihirapan ka sa subject mo, in case na sabihin mo, invest na sabihin mo, ang NCM 109 ay nakaka-nosebleed, sabihin mo, ang NCM 109 ay nakaka-CSF leakage. Ayan, nakaka-CSF leakage. Yung cerebrospinal fluid sa brain mo lumalabas, okay, dyan sa ilong mo. Okay, mas maganda yon, mas nakaka-intellectual na yun ngayon na sabihin mo. Okay? Instead of saying na, nakaka-nosebleed yung sinasabi ko, hindi ko maintindihan yung mga sinasabi mo, ayan. Okay? Gas-gas na yung nosebleed. Ngayon naman nakaka-CSF leakage. Let's go!
Sir,
Yes.
teka lang po. Yung sa nitrazine po, so pag no changes po, alkaline, ibig sabihin may CSF po dun sa
So,
paper.
ibig sabihin, positive siya for, check na natin, double check na natin. Positive siya for CSF. Wait lang.
Opo,
Okay.
sir.
Verify na natin. Nitrazine, CSF. Cerebrospinal fluid. Wait, guys. Nitrazine, CSF. Later na lang. Okay? Basta for now, guys, ganun siya. Pag nag-pink siya, acidic. Pero pag nag-blue siya, na-retain yung color niya, then pag na-retain yung color niya, then alkaline siya. Okay? But you have to remember that your CSF should be basic or alkaline. Okay?
Sige po, sir. Thank you po.
Yeah. Okay. Sige, ituloy na lang natin ng alauna. 11:30 na. Are you all hungry?
Yes, sir.
Okay, sige. Tuloy na lang natin ng alauna kasi alam ko dire-diretso yata kay Ma'am Jess. Baka hindi kayo nag-merienda kanina. Sige, let's continue at 1 o'clock. Okay, with your quick and stance test. Sige guys, I'll see you guys later. Any question? Any question for now?
None, sir.
Other questions?
None.
Sige. Okay, sige. I'll see you later guys. Bye!
Bye po.